Hi, this is Dr. Bernstein with session 14 of Dr. Bernstein's Diabetes University. And today we're going to talk about tooth infections or infections in the mouth. Now, why on earth would I want to talk about that? Simply because it's just so common. Almost every diabetic patient runs into this sooner or later. In fact, when I see new patients who are diabetic, but they're new to me, virtually 100% of those over the age of 40, actually it's 1% minus 2 people over the past 30 years, have had root canal infections and root canal treatments. So significant tooth infections are pretty darn common, and they're even common in children. Now, I want to cite a true story to show you the seriousness of this. I had a patient who was a 10-year-old boy whose mother called me because all of a sudden his blood sugars were very high, where they had been normal for months. And I said, does he have a cold, a sore throat, any kind of infection anywhere? And she said, no. I said, he's got to go to the dentist immediately. And does he have any pain in his mouth, any toothaches? Nope. Well, have the dentist tap on every tooth. He should tap on the biting surface of the tooth and on the buccal surface, with the side of the tooth, because sometimes tapping will elucidate pain or tenderness and identify the tooth with the infection. He should also look at all of the gums to see if any gums are puffy or red, because there could be a gum infection. And as a last resort, if the tapping doesn't disclose a problem and the looking at the gums doesn't show anything, you touch each tooth with a chip of ice, and most dentists have ice crushers or some way of putting cold on a tooth. So they took the young man to his dentist, and the dentist refused to tap on the teeth. Instead, he did something that 50% of the dentists do. He did a panoramic x-ray, which at that time cost about $200. And a panoramic x-ray will not disclose an infection in a tooth or around a tooth, but it's very profit effective. And this dentist refused to do any tapping. He did a panoramic x-ray and of course found nothing, because it's not possible to find what we're looking for. And the father phoned me from the dentist's office and put him on the phone. The dentist said to me, he's not going to let a non-dentist 3,000 miles away tell him how to treat his patients. I said, that's fine, but I can assure you that if you don't tap this kid's teeth, the entire family is going to go to a new dentist. Well, he ended up tapping the teeth, found one tooth that was tender, it was a wisdom tooth, and he extracted the tooth and found the kid had an abscess under that tooth. So, and right away the kid's blood sugars went down. This is a typical story. I've actually had identical stories with other children where the dentists wanted to do panoramic x-rays and refused to do the tapping. Now, this does not just apply to kids, it applies to adults also. And frequently, they find a tender tooth, and the dentist may not know whether it's a gum disease or an endodontal disease like a root canal infection. So if he sends the diabetic patient to either a periodontist who knows gums or to an endodontist who knows root canals, they are capable of making the diagnosis. By the way, what the endodontist would do besides looking at gums would be to stick a probe between the gum and the tooth, and if it goes down more than 6 or 7 millimeters, he knows that he has an infection. Now, how do you take care of the infections? You either go to the endodontist, the periodontist, and the one who's appropriate for the type of infection will do the treatment. Now, how do you prevent this? First of all, you should either floss after meals. My teeth are too tight for me to floss, so I keep these little plastic toothpicks handy that have a little plastic brush at one end that fits between my teeth, and I use this after meals. In addition, you should brush your teeth thoroughly twice a day, and ideally use an electric toothbrush like the Sonicare toothbrush or any one of these electric toothbrushes. When you brush, you go over each tooth twice using a W motion up and down while you're moving the brush across the tooth. And you should do this at least twice a day. And you should get plaque scraping by a dental technician every 3 months. That's really a must. They're slightly expensive. They may cost $100, $125 in the USA, but the cost of a root canal treatment or a gum treatment is so much greater that just preventing the infections can save you a lot of money. The plaque scraping is best done in the office of a periodontist who usually supervises, that's a gum doctor, who usually supervises his technician and checks for cavities and so on at the same time. So this is an important subject. It's hard to overemphasize it because almost every patient who comes in has a history of these tooth infections. And even kids will frequently get infections, especially with newly erupting teeth. So take good care of your teeth, and we'll see you with the next session of Dr. Bernstein's Diabetes University. Thank you. The bulk of what you've heard on this video appears in my book, Dr. Bernstein's Diabetes Solution, which is available at most internet and local bookstores. It is published by the Hachette Book Group. I'd like to remind you that we have monthly free teleseminars every month at the site askdrbernstein.net. Doctor is spelt DR, so askdrbernstein.net for a free monthly teleseminar. Sign up a day or two in advance so that you get a reserved seat. Good luck, and thanks for listening.